is my diagnosis, and this is my dad.
Hi, I'm Adam's dad. I'm Pat Foye. I'm a physician in physical medicine and rehabilitation at Rutgers, New Jersey Medical School. But in the context for this talk, I'm Adam's dad.
All right, so the topic of today's talk is living better with life hacks. And so first I'd like to explain a little bit about what that means. So a life hack is something that you use that makes your daily life better. It's a little trick or technique that makes things easier and more effective. And in particular, we're going to be talking about how this can apply to a medical condition. Normally, life hacks are for daily chores, and they're used for productivity, efficiency. And so when we use them for disability-related activities, they can turn day-to-day medical challenges into small victories. And the way in which they do that is they help you manage your medical condition better, either by saving time or by making things simpler so that you can conserve your energy for more important things. So that's the ultimate goal with these life hacks. So the format for today's session is going to be that my dad and I are going to share with you life hacks that we have used and that we find to be very helpful, but we would also like to open it up for anybody else to share some strategies that they have found to be really helpful. So we're hoping this can kind of be like a back and forth where we all come out of this knowing some tips that are going to be very helpful. And so with that, we'll move on to our first kind of topic, which is going to be hacking your time. And Dad is going to be talking about that one.
Great, thanks. Okay, so the issue with disabilities and time is that having a disability is time consuming, as those of us in the room know. Everything from how long does it take to get dressed, go to bed, get in and out of the shower, get something to eat. Those things are more time consuming. So part of what I do in my regular day job, as a physician at a medical school, I train young physicians and I train them how to be efficient and productive. And those types of skill sets and mindsets are all the more important for somebody who has a disability or a family with someone affected by a disability because of the time intensity of just day-to-day getting through the logistics of daily life. Efficiency means spending less time doing the things you don't want to do, and then that frees you up to have more time left to do the things that you do want to do. And it's really important to balance your work life, your health, your social life, personal interests, sleep, and everything else in between. So that really you save time and energy from sort of the day-to-day chores, so to speak, so that you have more time left over to spend doing the things that you enjoy, which we have lots of those too. All right, so as far as efficiency, one of the key things that's super helpful is batching. And the idea of batching is that rather than if we wanted to make a couple dozen chocolate chip cookies, you wouldn't make them one at a time and start your oven each time, or if you were doing your laundry, you wouldn't do it with every pair of socks. You would batch those all together. But sometimes we found that things would sneak up on us related to general day-to-day care. So something like cutting the dressings for a gastrostomy tube, or preparing the morning mix for the formula would be things that we would be doing every day, and then we'd realize, boy, if we just did this once for the week, in 5 minutes you can sort of bang it out, and it's a lot quicker, and your mind can be focused right on that task, while you're getting it done. And another whole area is habit formation. And there's a saying that bad habits are easy to create, but hard to live with. And the flip side of that is that good habits may be hard to create. You may have to put in some time and effort on the front end, but then they're easy to live with. They make your life easier in the long run. And two of my favorite books from the last couple of years, one was called The Power of Habit, and another one is Atomic Habits. And they really go through how do you generate and create new habits for yourself. And I can talk for an hour just on habits. Sure, come on and welcome. Good to have you. Yay. Awesome. So other issues in terms of problem solving and planning. There's plenty of seats up front and in the second row here. So a lot of times we're facing complex medical issues and we're looking for, when we can, we're looking to have simple solutions, or at least to simplify them to the extent that we can. One of the things that we found to be super helpful is to have checklists. So we have checklists for all kinds of things, everything from, what are the things that go into the morning, formula mix to, literally we have a sick checklist. So if Adam has an upper respiratory infection, not to have to recreate the wheel, or if Sarah and I happen to be away and somebody else is there, to actually have someone be able to say, oh, check for this, get that, here's which equipment, here's the things that we have found to be most helpful in the past. A mind map, the idea of a mind map is sort of just a brainstorming session, so sometimes you'll face, boy, why is my child more tired lately, or why is, his breathing seem more difficult, and literally sort of saying, well, what's everything under the sun that it could be, right? Is he sick? Is there a change in the ventilator settings? Is there a leak in the tube? And literally just thinking wildly, everything under the sun and sort of mapping it out. And then you can actually do the sort of the scientific process of going down the list and saying, okay, well, let me check this, let me check this, let me check this, let me call the consultant or the specialist about that, so that really you can put it all into context. And in the end, you're going to need, really a multi-pronged approach where you take lots of things into account and you brainstorm together as a family, and also, with your experts, your consultants, and with other families, which is also a hugely important, resource. And, sort of the old Boy Scouts motto of be prepared, so that you have plans in place so that you don't have to scramble, when it comes time to do, one particular task or curveball that may come your way. Because really, when you're in the middle of a crisis, when it's, in fact, in one of the earlier sessions today, we talked about sort of, if you have to go to the hospital, things like bringing your own equipment, bringing a list of medications, bringing a list, if you have thought about that in advance, when things are nice and calm and you're having, an iced tea or a lemonade and you're sitting around as a family, you'll have the presence of mind to put all of the things onto the list, and then you'll remember a day or a week later that you forgot a couple, and you'll add those to your list. And then when the crisis hits, it's, oh, that's right, we have to remember, to bring such and such. And that's true even whether that's a crisis or that's true for, oh, we're flying across the country. At one time where we got onto an airplane, and we didn't have the plug-in for Adam's ventilator. So it was like, oh, okay, Dad is hopping off the airplane and driving home and catching the next flight to be there for that night for the nighttime ventilator. So obviously, we live and learn. So you go on. So having plans in place, a sick plan, a hospital plan, what do I bring to the airport? What do I bring on a trip? What does your child need? Those kinds of things can be super, super helpful. What do you do if you lose a caregiver? Who do you call? Phone numbers, all of those kinds of things. Having those, written out in advance at a time when things are calm, the power goes out. Okay, well, number one, you can let your power company know, but also, what are you going to do? Like, oh, well, we have the flashlights here, we have backup there, we would go to this, hotel 2 towns over if we needed to spend the night, those kinds of things. Moving on to doctors and insurance, this is, could be a whole talk unto itself, but basically, as a physician, I can tell you, it's important if you come into your visit with an idea of what is it that you want to get out of that visit, We need this paperwork filled out for school. We need a letter of medical necessity for the cough assist machine, or for feeding tube supplies, or a new wheelchair, or whatever that's going to be. It's way, way, way more helpful if you go in thinking, here's what I need, rather than waiting until the doctor, whirlwind comes in and they're leaving and they have their hand on the door knob and 1 foot out the door, and then you're saying, oh, but we didn't talk about such and such. Now it's going to be a much more rushed, coverage of that area. So thinking beforehand and then during the visit, making sure that the doctor has covered those areas. If they're doing the notes, making sure that we have one physician who is a great doctor in many ways, but sometimes makes errors within the notes, and that has then caused us problems downstream with getting things insurance authorized when it says, Adam can do something that he can't do. And so to the extent that you can clarify and make sure that those things are correct. And then before you leave, find out, how do we get a copy of the note? Sometimes through the portal, you'll be able to get some summary, but a lot of times some of the portals really just give you a very brief summary, like here were the vital signs and the medications. If you can actually get the doctor's actual note where he or she spells out, here's what I'm thinking and why, that can be hugely helpful. You can check those for any errors. You can make sure that you understood properly that the message that you came away with from the visit is the same as what the patient has, and then saving those records, in paper copy and electronically, however that is, because you will be the absolute expert on your family, your child, your person who's affected. And insurance, if you're talking to the insurance companies, to the extent that you can read the letters, if you have a denial letter, what exactly is the reason for the denial? Can you get a copy of the policy that's based upon? Because often you'll find that they'll tell you, oh, well, it's denied for reason X, but then when you read the policy, it says we deny for reason X, except for under condition ABC, and you're like, oh, well, my kid has ABC. What, like, how did you not, So reading the policy for yourself, learning what the terminology they use, so you use their phraseology because that's what's going to trigger. If you find out, oh, it's covered if you call it such and such, then you say, okay, fine, I'll call it such and such. On the phone, documenting, as soon, getting the habit of when you're making a phone call, the date, the time, the number you called, who you spoke with, what representative, is there a reference number for this call? Do you need to speak to a supervisor if the person can't answer your questions themselves? And then your sort of action plan for, okay, what's on my plate to do and what's on somebody else's plate? When are they going to do it by? And following up then to make sure that those things get handled. Other things medically, having a one-page summary. I think one of the things that came out this morning was having, I think someone said, yeah, in the emergency room, they have a brief attention span, right? So the idea that you cannot show up in the emergency room or a hospitalization or an office visit and expect the medical team to go through 15 binders filled with every medical visit you have ever had and every test. But you can summarize on a single page, okay, my child had a gastrostomy tube placed at this age, and here's what he's using for feeding. Here's the list of medications. He's uses a nighttime ventilator at these settings since this age or since this year, and then that can be a hugely helpful way for any new clinician or new emergency room doc or nurse at a glance to say, oh, I can see the gist of what's going on here. So summarizing will make you kind of summarize to really the most important points. And then having copies of that in the cloud or someplace is great because you can access it from everywhere. But it's also great to have physical copies because the head nurse is not at the ICU is not going to take your phone down the hall to show it to the critical care attending or what have you. So having multiple copies printed out, it's like, here, take this for the chart. You can keep that because I've got 3 more in my backpack. And then I'm going to turn it back to Adam for medical supplies.
All right. So for medical supplies, when you're living with a disability, there's a lot of them. And the thing is, we are not trained to run warehouses, you know what I mean? But really, your home is going to have to almost function like one. So we're going to present some tips on how to kind of manage that. One of the things that's really, really we would want to stress is stock up, have a lot of extras, because it's better to have more than you need at this very moment than to run out and not have enough and then have some kind of emergency. And going along with that is having backups, because things get lost, they need to be replaced. We've had it happen even last week in my family that they had some of the things that were critical for me to have tube feedings, they were on back order. So what do then? Well, if that's the only way that you can get it, then that's a big problem. But if you have some stored in your home as a backup, then it's not so much of a problem. Anything can happen, so you should think ahead about that. The other thing is that when you have a medical supplier, you should really stay on top of the deliveries, because a lot of times you do not actually get what you need. maybe they say they sent something, maybe you requested them to send something, and you didn't end up getting it or getting enough or the right kind. So you want to be in constant communication, and you also want to be constantly checking the orders that are coming in. The other thing that's very important if you use medical items that run on electricity is that you need to charge your backup batteries, because what could happen if something died in the middle of some important thing, or you're going out somewhere, or whatever the case may be. If you have backup batteries charged, it's really helpful, especially if there's some like crazy storm. In New Jersey, we got a couple of years in a row a string of really bad hurricanes, and this was before our house had a generator. And so it was really critical that we would actually get a call from our power company. They'd say, hey, we're predicting a storm is coming in the next 24 hours, and there may be power outages. And we say, okay, well, we'll charge up in that case. Now, this life hack applies to finding the right items for you, because there are so many medical supplies out there, but there are not so many out there that may be right exactly for you. So one of the things you may need to do is really keep trying and keep pushing. If something isn't working, say, hey, this isn't working, we need to try something else. And so we've done this for ventilator masks, syringes. I could not tell you how many syringes we have gone through in order to find the right kind. And in fact, it turns out that the right kind of syringes for what I need are apparently used for squirrels. They're squirrel syringes. That there are people that really love taking care of these squirrels, and they nurse them with these little, they put milk in these little syringes, and it turns out that's the perfect fit for me. We would never found these that work great if we hadn't kept trying and kept thinking outside the box about which product we might want to find. And I have orthotics up there as well, because for my shoe, I wear an orthotic on my shoe, and when I know that for this particular product, it works for me, but not right out of the box. So I have to tell the orthotist, okay, you have to manipulate the orthotic in a certain way that it's comfortable for me, and then it works fine. So you really want to advocate for yourself when it comes to these kinds of things. On the other hand, there are some times where you find nothing that really works. And when that happens, you actually want to see, how can I make this work by customizing it? So we have made in our home a lot of makeshift and homemade items that can create solutions that did not exist previously. And so Mom is great for that. She has made a whole lot of things. I call them mom traptions. They're really special. Can't get them anywhere else on earth. And pretty much an example is for my ventilator, the headgear that holds the nasal mask to my face. She actually would sew straps so that it could fit my head just right. We have had tubes that were popping off in the night, and so we have a special way of taping them that keeps them together. We've even had, not this particular one, but I've had an electric scooter that had no headrest. So what we did, we had an old car seat, we just put it up, and then I could lean right back on it. So my point being that there are solutions out there that you can create for yourselves if nothing else is working. And so you really have to be very resourceful, but it's a very helpful technique. And now back to what I was saying before, that your home is not a warehouse. And so, you may be struggling with space, or you may be struggling to find things or stay organized. So one of the biggest ways that you can keep track of all of it is with labels, like labeling everything. And even you would walk into our house and think it's ridiculous the amount of labels that would be on something. If this was, if we were labeling this microphone, it would be microphone for sci-fi talk right here. And you would think, okay, that's obvious. But an example is if you have caregivers or you're training somebody new, that may not be obvious to them. But if you're sick or something and you say, oh, go get me this, and they're like, well, where is it? What does it look like? Oh, it has the label right there. So it's really helpful in that case in particular. And the other mantra that we follow is having a place for everything and everything in its place. So whenever we get a new shipment of tubing, for example, we know exactly where it goes, we put it there, and then when we need it, we get it there. The other thing that we do that's a kind of neat life hack is having special kits for certain things you may need that are all kept together. So an example being that when I get sick, there's certain medicines, there's certain supplies that I'll need for when I get sick. And you know that when you're sick or taking care of someone that's sick, the last thing that you really want to do is be running around the whole house trying to find whatever it is you need. But if you have everything together in a sick bin, labeled of course, then everything is right there, and it's as easy as saying, okay, go get the sick bin from the closet, and there's everything you need. You just have it at once. So that's a good life hack for storing your things. And now, similar to storing, but this is more organization, especially for medical records. At home, we have binders and binders and binders, like this thick of medical records. And how do you keep track of all of that? So we have some life hacks for hacking your organization of your medical history. One of the things is you really want to have not only physical records, but also try to get them electronically. And so you can have papers in your binders, but then also you keep your PDFs on your computer, and you can also keep them in the cloud. If you upload them to some kind of cloud service like Google Docs, Dropbox, etc., then you could have everything you need, even if, let's say, you go to a doctor's appointment and you forgot a paper. If you have it somewhere, like on your phone, then it'll go wherever you go. And some very important documents to keep are those related to your diagnosis, because almost every doctor that you go to is probably going to want those. So biopsies, genetic tests, that kind of thing. The other thing that I didn't mention on the slide, but that's really helpful to have, is a list of current medications. And so another strategy you can have is, if you're going to a lot of doctors all the time, it's really helpful to have a calendar of when you saw each of them. So if you use something like Google Calendar is what I use, and you keep a list of, all right, this was the doctor's visit we did on this day, or you had an important medical procedure or surgery on this day. Or an example is for my G-tube that it needs to be changed about every 3 months. We do it. So we could think, all right, does it need to be changed? Well, check when was it last changed, and we would have that in the calendar. And since it's electronic, we would just search it up, and then there it is. Also, anytime that you're changing your medication plan, then if a doctor is asking you, questions about that, you would have it right there. And that's for big picture dates of things. But another good thing is for daily things that are going on all the time. You could keep a diary or a journal or whatever you like to call it that would be tracking your daily symptoms. So, you could write, what was your pain level today, or anything that you would want to be keeping on top of. And then, if you look back on it, if you need to, refer to it later, then you have it all right there. And here's another one that's very important, is when you take a step back and look at, the progression of your entire life, you really need some good tables and graphs. So this, you may have seen before, is a growth curve, and that just shows you, how you've been gaining height or weight, and it'll show you whether that's at a certain percentile if you're meeting that age group. And it can be very helpful for looking at trends in the big picture. Because if you're only focusing on the day-to-day, you may not notice things that have been happening over a very long period of time. And some examples that are very good to have: growth chart, like the picture there, and also pulmonary function, vital capacity. So you can see trends like, is this increasing? Is it declining, or have I generally been stable over the years? And that can kind of help guide your whatever your approach is to your condition. because you have a better idea of what needs to be addressed, what's been changing over time. And these are hacks for personal hacks, for just general well-being. How do you stay healthy, happy, etc., while also managing your disability? Here is something that I would really want to stress, and if you take away one thing, I would say this is very important. Hydration, nutrition, and sleep. It is crazy how many problems you could think are really complex problems that if you address those three things, they disappear. And so, of course, these are the things that you really want to go to first if you have a headache, for example. Have you been drinking enough? When was your last meal? How did you rest last night? Do you need to take a nap? And if you do those things and your problem goes away, there you go, that was it. And if it doesn't, then you know there's something else going on, but you've at least done the simple things that you could do. And so when you have a very complex medical condition, of course, it can sometimes be too easy to overlook something as simple as just drinking water. So don't forget the basics. And these are very important life hacks as well for avoiding sickness, because in my opinion, the number one thing to staying well is just not getting sick as much as possible. So one of the things that we have a policy of doing in our family is we ask our friends and relatives to just please stay away if you're sick or you have it. Yeah, that as well, hand sanitizer. We bring it everywhere. So pretty much if somebody's sick, then we'll just ask them to keep their distance, and that can help a lot, because if you know your friends and your family, they know your situation, they understand, then they will hopefully be mindful of that in the future. We actually, in fact, on our front door have this little sign that if you're sick, please let us know, and we want to be careful, and it kind of sets the tone for the household, for anybody coming in. It would remind them, oh, that's right, I really got to try not to get this person sick. Vaccines. I cannot stress enough how important vaccines are. They really save lives, so I strongly encourage you, but also your friends, family, caregivers around you to get those, because that's one of the most easy and important things you can do for staying well. And some other life hacks for avoiding sickness are hand washing and hand sanitizer. Like you saw him, we literally will keep it in our pockets a lot of the time. Just if you touch something that you think is dirty or you're worried about getting sick, then just go ahead and use some hand sanitizer. We also carry disinfectant wipes, and those are really important for surfaces that are used by a lot of people. Really, I should have done one on this microphone and the clicker, but those are examples of things other people have been touching. So you want to either avoid them, clean them, or wash your hands after you use them, or all three is really good. And some of the things that I do this on regularly is phones you use, keyboards, desks at school can really, if you think about how many students a day are using those, and if some kid in the period before you sneezed on his desk and then you walk in and then do all your things on your desk there, then that's really increasing your risk of becoming ill. So you just clean off things like that. Other ones are doorknobs, airplanes, and that kind of thing. And that can really help you reduce your risk of coming into contact with something that could put your health in danger. And now my dad is going to explain some of advice for not only specific life hacks, but how to access other ones.
So I think this is one of our last slides, but basically, looking for resources. Not, the whole, the old saying of, no man is an island. None of us can get through, just normal daily life alone, let alone, when we or someone in our family, has, a disability of some sort or another. But the good news is that there's lots of resources out there. There's other people in this room. There's networks that that you can join. Even things like if you're trying to learn more about your particular condition. So for our condition, Titin, T-I-T-I-N, myopathy. if you do a Google search, you'll see what you find, but then down at the bottom, you'll see a place where it says, do you want to get Google alerts? So in Google News, if there's ever a story that comes out that has, that has the word Titan in it, Sarah and I, we get an email that very day. And then it's like, oh, what is that about? Is there some celebrity who's been diagnosed with something, or is that something that that the news media picked up on some research article, or something else along those lines? Similarly, within PubMed is by the National Institute of Health has a National Library of Medicine database of published medical journals. And even you may be thinking, boy, if you're not in the healthcare or science industry, or world, but just having a glimpse at what's the topic, just from reading the title and the abstract, you may have something that triggers for you, like, oh, this particular article is talking about tremors and my type of myopathy. You know what, my local doctor at the MDA told me there was no such correlation, but now there's an article that says there is. Oh, maybe that applies to you, maybe it doesn't, but it basically gives you, something to either share with them or bring up at your next visit or email to them or whatever else the case may be. So those are sort of, sources where, Google or PubMed will do the work of sending you the update. The Center for Disease Control has information about, everything from, how effective is the flu vaccine this year? How is the flu in your area? So, for example, there was a couple of years ago where the flu was really, really prevalent, and in New Jersey it was reaching these, like high red critical levels. And having that information gave us a basis for saying, like, okay, should Adam be going to school on these days? And then talking to the school nurses, and the nurses are like, oh my gosh, you would not believe how many kids are out sick. Like we've never seen it this bad. That has us think, oh, okay, for those kids, they're going to be sick for a week and be fine. For Adam, he might end up in the ICU and a whole host of other, things, or it may just be that he gets a common cold and it takes him, a month to recover instead of, 5 to 6 days. So really being proactive and being on the front end can really be a huge positive in your favor. So looking for that localization, what's going on in your school district, or talking to your pediatrician about what they're seeing locally in your community, and then certainly Facebook groups for myopathies in general, or Cure CMD, or for your specific type. Sarah has one for those family and folks affected by Titan myopathy. That really you'll find lots of other people on the groups, other moms, dads, patients, others who can really clue you in that when you're saying, boy, I'm finding problem X, Y, and Z, there's a good chance that somebody else has already, faced that problem, and you don't necessarily have to go through the same struggles or make the same mistakes that they did. You can, learn from them and go on from there. So with that, we really want to open it up to, sort of questions, answers, either things that, and if maybe, Sarah, do we have somebody, or Tara, maybe someone to run the microphone to folks? Sarah or Tara, or Sarah maybe? So if people have comments that they want to make, either questions or comments or things that worked well for you. And, so, again, whether it's any of the topics that we talked about or something totally, totally different.
I'm spotting a life hack right where the app chair adaptation right here.
Yes.
Yoga block.
Yes. You're right.
Yes, please.
Hi.
She's turning.
It's on.
Do you need another one? You want that?
Try that one. Don't know why that one's not working.
Can you hear me now?
Yes.
My name is Lori. I'm from Alabama. My daughter's 6 and has Nemaline myopathy, and I'm also an OT. I try to be the parent and let the rehab specialist be the rehab specialist for her. Just one little life hack I've learned along the way, especially dealing with doctors and insurance. I deal a lot from the emotional side, and tear at their heartstrings. And I've even gone as far as asking insurance companies how they sleep at night when they deny us things like my daughter's formula for her G-tube. It's come to work well for me. I try to be nice in the beginning, but when they continuously no, then I get angry. And my daughter was in the hospital recently, and a friend of mine was keeping my 4-year-old son, and he said, Miss Jenny, watch this. And he picked up her phone. He goes, I'm going to call the insurance companies like Mommy does. And he's pretending to call them saying, why won't you help my sister? But, yeah, so just it sometimes, you know, nice works, but I've learned tearing at heartstrings really works.
We don't live in a very big place, but there seems to be a couple of businesses in particular that are very difficult to find parking for, especially unloading a wheelchair. Walmart and Costco are the ones for some reason. And so one of the hacks we've done is we bought some traffic cones and put disability stickers on them, and we'll put them in the spot next to us and block the spot out and park in a typical spot, just because otherwise we can't park anywhere.
You have a side entry?
Side entry, yeah. Yeah, so
So if someone pulled right up next to you,
we have orange cones staked out in place,
right.
and then you've got disabled stickers on them, so they know that's why it's staked out. It doesn't work when it's windy. We've never had anyone move them. We've only had to use them like 2 or 3 times. In general, people are pretty appreciative of the reason. And when they see a little girl getting into a van, they're like, they stop being a dick pretty quick.
that's awesome. I love it. Yeah.
Here, I'll step over here. I don't know how many of y'all you have corporate laptops or connections to Microsoft connections, but my wife and I, we try to handle as much of the medical stuff with my one person. When it's me, I use OneNote. It's typically included with all your Microsoft packages. It's amazing. You grab it from your phone, have all your notes in one location, and that's when I call. It keeps me be able to say, okay, I talked to this date, this is what we discussed, and it just, instead of having a paper copy, which then I get sticky notes and everything everywhere else, it makes life easy. That way I type and talk at the same time. So.
Very cool.
Sorry, me again. On OneNote is amazing, but also we found, because we're getting so much paperwork, Dropbox is really good. So the Dropbox app actually has the ability to take a picture of any document, and it automatically recognizes the edges and scans it as it went through a scanner, and then you can quickly name it and put it into a folder. So if you're going through either receipts or records or whatever else, it's a real quick way to get things digitalized just from your phone. And you can search as well. All the text becomes searchable, so it's just really quick and easy.
Awesome point. And I have to say, as a physician, it amazes me how often we were in medical appointments where the doctors didn't have the data, and my wife Sarah would say, "Oh, you don't have the blood work from 2 months ago," or "Oh, you don't have his previous sleep study, but you're trying to tell me what's new about the new sleep study, but you don't have the old one to compare to." "Oh, I have that right here." And it's either, and just the time spent on the organization on the front end to have a tab for, okay, because, this section is about sleep, and this section is about pulmonary function studies, and this section is about, the feeding tube, and here's a list of the different formulas we've tried, and here's, like, that, it's hugely valuable, because you may have a world expert in whatever trying to help you and your family, but if they don't have the data to go on, it's sort of like spinning wheels to some extent, Whereas if you have that, and you can say, like, "Oh, hey, we're having a problem. Let me tell you what the vent settings were. And since then, the morning headaches are now, worse since we did this or that to the pressure." Then you'd have some, expert, like I'm just looking at our pulmonary, physician here. He's slurping down, slumping down. He'd be then able to say, "Oh, I can see what direction you're going, or why this is getting better or worse, based on what we see." But if I was just in there saying, "Hey, I don't know the vent settings, what they are at home," he'd be saying, "Well, Pat, that's, what am I, how do I know if I'm supposed to tell you to go up or down on this or that, parameter?" So Okay. Who else? Yes, in the back.
Are you familiar with any humidifiers that can be used for travel that are battery operated? Are you familiar with any humidifiers that are battery operated for travel? Nope.
Sir, was there something?
They have the inline humidifiers that are HMEs, but they're not
Yeah.
probably as effective, but I'll leave it to the experts.
So you can use an HME, which is a heat and moisture exchanger, also known as a nose, because that's what your nose is supposed to do for you. But they are passive, meaning air just passes through them. I live in a very arid climate, so this is near and dear to me. And essentially, what we do is we hack stationary humidifiers for ventilators and get them on the chair any which way we can and stabilize them. But there's a lot of spills when you do that, but it's the best we can do. I have some patients who nebulize saline frequently in order to create humidity, but you get swings, really humid, really dry, really humid, really dry. So that works for some and not for all.
The time when we've used that is when, like on a plane. So we have this battery pack, so we're talking about using it on a plane or so basically, we have, Adam uses the ventilator just at night. But we also found that, he would be fatigued after a flight. We're saying, well, there's pressure changes and other things and just the stress of travel and just that time to sort of rest where, physically the ventilator is doing part of the work of breathing, has him, we've been to many countries and many trips and, fortunate to go to great places and really and the ventilator helps him get through that flight, in a way where his energy level afterwards is not so tanked. And then, one other thing too is, the ventilator is, our ventilator is FAA approved to be used in an airplane. But we've had times where a flight attendant will they don't know what that thing is. That's, you're opening this big thing and taking out all this tubing and these battery packs and the lights are blinking and the alarm is sounding and and it's sort of like, that would stress out a responsible, flight attendant. And yet, having in our vent bag, we have a, sort of in a plastic sheet protector. Here is the FAA approval for this machine to be used on an airplane. And that just changes everything from, wait, what is that you're doing? What have you got there, Van? To, oh, this is an FAA approved, ventilator, for airplane, it's okay for airplane use. Here's the document. Oh, okay. And then they may take that and go and talk to somebody, the head flight attendant or something, and then they come back and they're like, okay, great. Can I get you anything? And you're like, no, we're good.
Everybody's situation is different with ventilation and humidity too, but we have definitely used the humidifier hooked up but not plugged in, and there is a certain level of moisture that'll run through it just in the chamber without the thing plugged in. For the humidification. And we have tried the HMEs too. You did, yeah. Okay.
There is some pretty decent capacity portable batteries that you can buy now that you can plug 240 or 110 into. We have two of them. We actually had a generator for a while, and then I was worried about it not working because it spent so much time unused. And I'm buying these small portable batteries, and they're made by a company called Jackery, and they're about $180. And we're actually able to power our daughter's power jet from it. It's that powerful. And I think for a humidifier, it might actually last for a good 8 to 10 hours there. Yeah, they're like 6 inches across. They're pretty heavy. I don't know about getting onto a plane, but you just have to charge them. You can charge them on your car, or you can charge them at home. They take a long time to charge, but once they're charged, they're really good.
And it has a standard plug they could plug in.
It has a standard plug. You can charge a phone like 50 times. You could charge off 110. So it's got a lot of different options.
Let's see. Other things on here. I'm trying to think of other things that we haven't gone through. Oh, when we're talking about the tables, a well-designed table as far as, like what's something, the measurements on a given date can be hugely, valuable. It was amazing when we were going through Adam's scoliosis, how we would meet with the orthopedic surgeon. They would do the measurements for that day, and then they would be looking back at the prior office note to try to find where in the prior office note they had the measurements from 6 months before. And then if they needed to go back for 6 months before that, they'd have to go back to find the office note from 6 months before that and scan. And there's only so much time in the visit. In surgeons, the visits are particularly quick. But the fact that Sarah and I had a table, and we said, oh, well, what is it today? We would have just a Microsoft Word or Excel table, and we would write in today's values, and then we would be able to hold it up and say, oh, so here's here's how it's been over the last 4 or 5 years. And that was just, it really gives you that snapshot view where now the surgeon can say, oh, I've kind of been saying each visit, there's a couple of degrees of measurement error, that you'd say, okay, well, if it was 39 degrees and today it's last time and today it's 40 degrees, that could just be measurement error. But if you looked at oh, well, every visit it's been a couple more degrees, you can now take a look at a few years and say, oh, we are actually seeing, a slow progression. It gives you sort of a bigger perspective than if you just went by one piece of data. And it always amazed us that it was us as the parents, making the table, right? You would think with multi-million-dollar electronic medical records that would be like an automatic feature, but it's not. And for some things it is, and for some blood work and other things. I don't know about PFTs. Do they typically import now?
I do.
You do, right?
I've hacked that.
But right. So he's hacked it so that he does, right?